Hello, it's Dr. Rick with another bulletin on the COVID-19 vaccination programme in Tameside and Glossop. Yesterday, I was talking to one of my patients who asked me, why do I have to go to one of these other centres for my COVID-19 vaccination? Why can't I come to the practice like I can when I have my flu jab? Well, the flu jab is very different from the current COVID-19 BioNTech Pfizer vaccination. Well, to answer this question, let me tell you what the flu vaccination is like. So every year in general practice, we have a guesstimation of the number of flu vaccines we need, and that's often several thousand. We put an order in for it, and the order arrives on a very certain day that we can predict. Straight after that date, we can then book many people into flu clinics and also do flus opportunistically. That means if somebody's in for their blood pressure, we can say, do you fancy having your flu jab now? Also, the flu jab needs to be stored between 2 and 8 degrees, the sort of temperatures you get in normal fridges. And we can immunise many different people at the same time. So we do the elderly, people with high-risk conditions, people in care homes, and we do them as they appear and as it's convenient to give them their jabs. Now, the COVID-19 vaccination, the one we're using at the moment, is very different. Firstly, it only arrives in packs of 975 injections, and it arrives at -70. It's an unstable vaccine, which means as soon as it's thawed, it has to be given within a certain number of days. So in my fridge at work, I've got flu vaccines that have been there for months, and they're still really good. But you can't do that with the COVID-19 vaccination. In addition, the COVID vaccine also arrives in what's called multi-dose vials. So basically little pots which need to have a little bit of fluid added to them, shaken up, and then 5 injections drawn off the same little vial or pot. Once the vaccine has been mixed up, you have not days but hours to give it. In fact, only 6 hours. This makes for a complexity which is not seen with flu jabs. In effect, we need to get our ducks in line. Step 1 is make sure your delivery date of the vaccine is confirmed. Step 2, send out invitations for people to attend. Step 3, make sure those people have booked their appointments. Then we need to arrange transport. And on the day, we need to thaw the vaccine, mix it up, and give it within a very short space of time. And all of this needs to be done without waste. You need the right number of people to have the vaccination in a day, and also without disappointment. It'd be awful to turn up at the end of the day and the last jab has already been given. So I take my hat off to anybody who's organising these immunisation centres. I think they're doing an amazing job. I hope we'll get as many of these vaccinations done before Christmas as possible.